So Uwah is going to give us an overview of NTDs.
Thank you. We do respect Your Excellency. I think I can see. Yes, come down.
From him, woke up one morning.
Yeah, we do respect Your Excellency and distinguished special guests who are here. Starting on the existing protocol, I'll just present a brief overview of neglected tropical diseases in Akwa Ibom. We'll also look at the progress we've made in the last 3 years and even more. We look at some challenges and some recommendations. Next slide. Next slide. Next slide. Okay, so Your Excellency, this is a picture of an NTDs warrior. In the fight against NTDs, we don't use the kind of weapons that are being used in Ukraine and Russia. We have what we call the dose pole, we have our tablets, and that's our own bulletproof jacket, which is a branded apron. That's what we use to fight NTDs in the field. And Your Excellency, I want to crave your indulgence so that by the time we are through with this summit, all the persons here would have been recruited as warriors against NTDs. Your Excellency, you will be the grand commander of that battalion. Thank you very much, Your Excellency. So these are some of the warriors. Some of them are here. Members of the state team, please can you rise up? They're the ones that we'll be working with to do a lot of work against NTDs. Next slide. So this is my outline definition, the burden of NTDs, the NTDs targeted for control and elimination in Nigeria, the types, the impact, the national NTD strategic agenda, intervention strategies, intervention programs in Akwa Ibom State, and the conclusion. So definition. So NTDs are a group of about 20 disease conditions that are found commonly in the tropical and subtropical parts of the world. And we all know Nigeria is in the tropical part of the world. And these are disease conditions that are closely associated with poverty, poor housing, poor sanitation, poor access to potable water supply, and poor access to quality healthcare services. And over time, these disease conditions have been termed neglected because they don't get the kind of media attention other disease conditions are getting, probably because they don't kill. I don't like using that word, but because they don't kill as fast as other disease conditions like malaria, COVID-19, Ebola, virus disease, Lassa fever, and all that. But even though these diseases have a very high mobility rate, people still play down on it. And that's why we want to see how we can remove that word neglected, as the commissioner had already pointed out. Then apart from that, these are disease conditions that affect the world's poorest. And we all know that when things affect the poorest of the people on earth, they don't get the kind of attention they should get. For example, when we had COVID-19 pandemic, within a year, we had a vaccine against COVID-19. Most time, vaccine productions take as much as 5 to 10 years. But because this condition affected the world's richest, a lot was done. So there's a need for us to do a lot more to help the people suffering from neglected tropical diseases. Then apart from that too, these people are stigmatized against, because most times, especially in this part of the world, that people believe so much in superstition, spiritual attacks and all that. When people suffer from these conditions, because most times they look very scary, people attribute them to superstitious reasons, spiritual attacks, witchcraft and all that. So people don't even want to get close to this set of people. So with all this, most people don't even want to talk about neglected tropical diseases, and the people suffering from them are further stigmatized and discriminated against. Next slide. So this is just a global picture of the NTDs, and you can see that they are mainly in the subtropical and tropical parts of the world. Those in the Western world don't really have any issues with neglected tropical diseases. Next slide. Next slide. So this just shows the burden of NTDs. Like I said earlier, these are disease conditions that have a very high morbidity rate, but a relatively low mortality rate, even though it still kills, because about 1 billion people across the world are at risk of contracting any of the NTDs. And data has shown that about 534,000 people die from NTDs every year. And in Nigeria, about 100 million people. When you look at the population of Nigeria of about 200 million, that means about 50% of Nigerians are at risk of contracting at least one NTDs. So it's a very big problem, it's a very big issue. which all of us, as stakeholders, need to be involved. But luckily for all of us, 7 NTDs account for 90% of the global burden, and these 7 NTDs can be prevented. So why are people still coming down with NTDs? Because there are free drugs that can be given to them, and they don't come down with those swollen legs, swollen scrotum, blindness, and what have you. Next slide. So these are the different kinds of NTDs. So in the control and elimination of NTDs, they've been grouped into 2 major subgroups. We have what we call the preventive chemotherapy NTDs. Preventive chemotherapy in the sense that you can give drugs to these people, and when they take these drugs, they are prevented from coming down with NTDs. And under this subgroup, we have conditions like onchocerciasis. The commissioner had mentioned it much earlier. Onchocerciasis causes blindness that are transmitted by vectors called the black fly. And they transmit these organisms called the onchocerca volvulus. And when it gets into your body, you can have rashes on your skin. You treat and treat and treat. It doesn't get healed. Or you could even have blindness as a complication of this disease condition. And in Akwa Ibom, 4 local government areas are endemic for onchocerciasis. They are endemic in Ikono, Ibom, Ini, and Ika local government areas. Even though we've treated over time, and we are planning to have an assessment conducted very soon, but we've been limited because of lack of funds. So there is a need for that to be done as soon as possible, so that we'll know whether we can continue to treat in that local government area. Then apart from that, you also have a disease condition called lymphatic filariasis. It may interest you to know that lymphatic filariasis is also transmitted by mosquitoes. The same Anopheles mosquito that causes malaria also transmits lymphatic filariasis. And there are round worms called Wuchereria bancrofti. And these are the worms that get into your body when the mosquitoes are feeding through the blood mills. They feed on your skin. They deposit those worms on the skin of the person. And with time, the worms get into the person's body, damages the lymphatic system, and over time, you start having swellings on different parts of your body. Your Excellency, maybe later I can show you some pictures of some men in this state whose scrotum are as large as the knee level. The pictures are there, and we keep on seeing them. When we go to the outreaches and we feel we've seen it all, by the time we go to another place, we see the one that is even bigger than what we saw, showing that our people are really going through a lot of hard time, and there's a need for all of us as major stakeholders to be involved to help them. Then apart from that, you have the intestinal worms, which the commissioner also talked about. We call them the soil-transmitted helminthiasis. Soil-transmitted in the sense that the soil has to be contaminated, or your water sources, or your food, or your fruits. So when they are contaminated with this ova of these worms, you ingest them, the worms multiply in your body, and they have lots of severe complications on maternal, child, and even adult health. And let me just highlight some. For some of us who have had wives, or for some of us women who have been pregnant, when you go to the hospital for antenatal care, one of the first things Professor Augustine will tell you is for you to take drugs to deworm yourself. Because once a woman gets pregnant, physiologically, her hemoglobin level drops. And by the time you have a huge worm infestation, it further crashes your hemoglobin level. And that woman is now prone to having anemia. Anemia just means a low hemoglobin level in the woman. And if the hemoglobin level continues to drop, the woman could have a need for blood transfusion. And if that blood transfusion is not readily available, she could have anemic heart failure and may even die in the process. So some of the maternal deaths in the antenatal period could be due to severe anemia, which could be due to intestinal worms. Then apart from that, it also affects the growing fetus, because if the mother is not having enough blood in her, it's going to affect the nourishment of the fetus and the growth of the fetus. So the fetus may not grow maximally in what we call intrauterine growth restriction or retardation, or even the death of the fetus. And when that child is eventually born, if something is not still done to reduce the worm load in the child, it affects the child's physical growth and even the growth of the child's cognitive development. So you now find children growing, and they are not growing to the heights they should grow. They become stunted, and everybody's wondering why. It could be because of intestinal worms. And you could have children who are going to school, they are not doing well, they are sleeping when they go to class, they are dull, and the teachers are complaining. It could be due to intestinal worms. So the complications are so much. So you now have children that are going to grow as adults, because their cognitive development was not optimal. They don't end up doing well in life. And we're wondering why there are so many people that are not, intellectually sound around us. Then we also have trachoma. Luckily for us, trachoma is not endemic in Akwa Ibom. Then we also have schistosomiasis. You know, the vectors are the water snails. Then apart from these preventive chemotherapy NTDs, we also have this other group called the case management NTDs. Under the case management NTDs, we have conditions like leprosy, which many of us are aware of, Bruley ulcer, we have snake bites, we have dog bites, we have yaws, we have leishmaniasis, we have sleeping sickness. Then we also have guinea worm disease. Luckily for us, guinea worm disease has been eliminated. Next slide. Next slide. So these are just pictures to show the disease manifestations and the different vectors that, you know, transmit this disease condition. Next slide. So this is just a map of Nigeria showing the co-endemicity. For instance, in Akwa Ibom, we have some local government areas that are endemic for lymphatic filariasis, onchocerciasis, and soil-transmitted helminthiasis. So that's what they talk when they say co-endemicity. That's what they are referring to. Next slide. So these are all case management NTDs. Next slide. So the impact is huge, it's enormous. Like I said earlier, it affects maternal, child, and adult health, and there's a need for something to be done. It worsens poverty, because when people are affected, they can't do what they're supposed to do. Like when the men are affected, when they have hydroceles, they can't go to the farm, they can't go to the market, they become a burden to even themselves. And this further worsens their poverty. And you can imagine what people are going through in a country that the economy is so bad. Even those that are working are having a hard time, you know, picking their domestic bills. Talk less of a middle-aged man who is not going to the farm, who is not doing anything because of an NTD. And these are the realities we are facing. You know, so there is a need for these impacts to be highlighted. Let people get to know that even if you feel you're healthy, there's another person, your brother, who is going through a hard time because of a preventable disease. And we are also talking about increased productivity. So when you, apart from the personal effects, when you look at a bigger picture, when many people are having this problem, because we are talking about people going to the farm to work, you know, to increase food production, you know, to boost the economy. But from the survey we've done and the data we've analyzed, most of the people affected by hydrosis are middle-aged people. And most of them are farmers in the rural communities where we expect these people to invest in agriculture. So when you look at the general productivity of a place, where many of our men are coming down with this disease condition, our general productivity as a people will be further reduced. Next slide. So our vision nationally is to have a country free of NTDs. And the program is focused to progressively reduce morbidity, disability, and mortality due to NTDs using integrated and cost-effective approaches with a view to eliminate and eradicate NTDs in Nigeria. So that is the ultimate goal, to have a country free of NTDs. Some countries are achieving it. Very recently, one of the countries, I think in West Africa, eradicated trachoma. So if a smaller country can do that, then we as a bigger country, a more endowed nation, can also achieve the same. So to control and eliminate NTDs, we have different strategies that have been mapped out. The first one is the mass administration of medicine. Under the mass administration of medicine, we have two broad categories. We have the school-based campaigns. So what we do in the school-based campaigns, we go to schools across the state and we administer these free drugs to our children aged 5 to 14 years. Like the commissioner said, just a dose, a tablet. And we've had experiences and different instances where a tablet is given to a child and the child vomits about 10 worms. One of the beneficiaries is Yesh. I think she will share our story. I know Our Excellency is very busy, but Your Excellency will just give us some minutes to just listen to some of these stories. The idea is to encourage other people, because most times people don't believe drugs work. But as a medical doctor, drugs work. There are instances where people are almost dying. You give them just a tablet and their lives are changed for the better. So we have all these different interventions, integrated vector management, then we have water, sanitation, and hygiene. And I want to use the opportunity to further commend His Excellency, the Governor of Akwa Ibom, Pastor Umoindo, for establishing the Ministry of Water Resources and Establishment. This is the first time we're having this in the state and the first time in the country. So the governor is even teaching the country what to do. Because if you can recall, after the governor had established this ministry, when the president also appointed ministers, for the first time in Nigeria, a minister was appointed for water resources and sanitation. So they are learning from Akwa Ibom. And it's the right thing to do, because most time people are infected with intestinal worm because of poor access to water supply, because of poor toilet habits, open defecations and all that. So this will really go a long way in helping us achieve that strategy. Then the mobility management and disability prevention, MMDP, a very important strategy which we are using right now in the States, because in the course of administering drugs, we have discovered that some people had already come down with these conditions. Most of them have hydrocele. So that's why we are intervening, conducting free surgeries, and most of them, Your Excellency, in the last cycle of surgeries we had, most people could not come when we called them because they could not pay their transport fare. And it was really, really saddening. We had never had that experience, but we can relate it to the removal of fuel subsidy. Because other times we call them, they just come voluntarily, but this time we had to even pay them monies to come and get help. Then some of them stay in the hospital and they just say they don't have monies to go back. And most of the time our team members have to squeeze out money to give them to pay their way back, because we don't want to add value to their lives. And these are some of the things we are facing on a daily basis. Next slide. So these are some of the things we've been able to achieve in Akwa Ibom. I'm not going to take much of your time because the commissioner has said so much, but from 2020 to date, we've done so much, we've achieved so much, and Akwa Ibom is in the positive trajectory towards eliminating at least lymphatic filariasis in the nearest future. So these are some of the things we have done. We have a newsletter which we have shared, which was quite innovative, just to further create awareness on NTDs. Go next slide. We've done quite a lot this year. Next slide. And these are some of the challenges. We have the challenge of inadequate resources for the implementation of our different strategies. Like the commissioner commended Aniekeme has been our main partner for some years now. But donor funds are not sustainable, because there are some things you would like to do as a state, but they do not say they don't have a budget for that. And there's nothing you can do. For instance, we want to print flyers, print posters in different dialects, but we cannot do it because we don't have the resources and the partners don't have a budget for that. And there are so many other things we cannot do because the funds are not there. We want to conduct surveys, assessment, but we cannot do it because they are very expensive, and if the partners do not have the budget for that, we cannot still achieve it. Like I said earlier, in the 4 local government areas endemic for onchocerciasis, there's a need for a survey to be conducted to know if we should continue to treat there. But the funds are not there, and these are some of the areas we believe stakeholders can look into. Then we have a huge backlog of persons with hydroceles. When we started in 2021 in our pilot surgery in Ikorobasi in partnership with NSEC Integrated Services Limited, we had just about 150 on our database. But because we're conducting these surgeries successfully, and when people go back to their different communities, they share their success stories. The men start coming out. So progressively, our data has increased from about 150 to more than 1,000. Because we are talking about disease conditions that affects a man's most sensitive part. And you don't expect a man to come out and say, oh, my scrotum is enlarged. No man does that. But a man would swallow his pride and come out because he knows he's going to get help. So because we've been rendering this help and these services, people are coming, and people are coming from even beyond Akwa Ibom. In the last cycle of surgeries we did, people came from Abia and River State. We could not turn them back because they are human beings who needed help, and we did those surgeries for them free of charge with the support of Aniekeme International. So we still need support to reach out to the more than 700 we still have on our database that need help. To conduct a hydrocelectomy will cost about 500,000 naira. And we're talking about people that cannot even afford 500 naira transport. So it's very difficult to just, find a bridge between these two. So there's a need for us as stakeholders to say, okay, I'll sponsor one person, I'll sponsor 10 people, I'll sponsor 500 people. And together, we can make a whole lot of difference and add value to the lives and livelihoods of our people. Next slide. So our recommendations, there's a need for us to have a technical advisory committee comprising of some stakeholders. So periodically we can sit down, interact, rub minds, and look at how we could mobilize resources and help people with NTDs to alleviate their pains and sufferings. There's a need to adopt, I'll be a bit passionate here, because I know that in this state, for a very long time, most first ladies, concentrate on only the women. But most times they forget that if the men are not happy, the women are not going to be happy. So I want to really appreciate our beloved First Lady, because the fact that she has come here today shows that she has the interest of the family at heart. We have videos of men who have told us that their wives left them. Why did their wives leave them? Because they could not perform. So in as much as Other first ladies have been investing in the women. I mean, we forget that a woman cannot even get pregnant when the man has a hydrocele. So to be more holistic in our approach, I commend the First Lady for coming. And I believe that the First Lady will do something to help our men so that the women can be happy. So there is a need for increased intersectoral collaborations, increased budgetary allocations to NTDs. It shouldn't just be at the state level, even at the local government level. Chairmen should budget something for NTDs. For instance, most times you feel people don't have NTDs. Maybe you see somebody always wearing agbada, wearing, you feel the person is a big man. Until the man comes to your hospital, and you now say, so this is what this man has been carrying. I mean, we see it every day. You see a man, moving, you feel, or the man is posing. But the man says that something is down there. You open it, you're like, wow, how were you carrying this for years? And we have stories of people carrying those things for 15 years. And most time, some of them have just consented to the fact that they will die with those conditions. Because they don't believe they will get help. Yes, it's the truth. So many of them. Next slide. So we want to appreciate the Commissioner for Health. And Your Excellency, I want to say this. That ever since Professor Augustine Uwah became the Commissioner, he has brought a lot of stability to the health sector, and especially the Ministry of Health. That's why you've noticed in the last 3 years, there hasn't been any drama in the Ministry of Health. And apart from that, he has created a conducive atmosphere for us as program managers to do our work. Your Excellency, ever since the Commissioner came on board, he has been the most supportive Commissioner to the NTDs program. In 2021, we had a flag off of our school-based campaign in the Kono local government area hosted by the chairman and other stakeholders in that local government area. The Commissioner was there physically. We had the second one in Uwah, supported by Senator Aniekeme and the chairman, and the Commissioner was there personally. And in every ideas we've come up to, push the, battle against entities forward, he has always been supportive. So, Honorable Commissioner, on behalf of the program, we thank you. I will give you all the support you deserve to have a very fruitful tenure of office. So we thank the Commissioner for Information and Strategy. Your Excellency, this is one of the best commissioners we've had in this state. The Commissioner, the first time I met him, I told him about NTDs. And immediately, the Commissioner gave us a blanket check to do any awareness we want to do on NTDs using any of the radio stations in Akwa Ibom. That's why in the last 2 to 3 years, you always hear about NTDs. All those have been done pro bono, courtesy of the Commissioner for Information, Comrade Aniekeme. He has been very, very supportive, and we are grateful. So Aniekeme, we can't thank you enough. The chairman of your local government area is actually the NTDs ambassador in Akwa Ibom. But Your Excellency, I want to crave your indulgence that moving forward, you'll be the grand ambassador. Thank you very much, man. So we appreciate everyone. Next slide. Next slide. Conclusion. The WHO has declared that the last mile is now. And to overcome the last few hurdles in the total elimination of NTDs following significant progress, we require the following. Next slide. Strengthening public health systems, limiting the transmission of disease. Those citizens should have access to clean drinking water, which the governor is already doing. The mass administration of medicine, which we are also currently working on. Next slide. Next slide. So I look forward to an Akwa Ibom devoid of these preventable, debilitating diseases. We can achieve it if we all care. And like I keep on saying, together, we can do more. Next slide. Thank you. Next slide. So these are just pictures of different activities we've been conducting since 2021, advocacy visits, World NTDs Day celebrations. We are always on the field trying to create awareness on NTDs. Next slide. We go to the churches, we meet stakeholders, local government chairman, that's Uwah chairman. We go to the villages, we meet people in the communities, we meet village heads, because we believe everybody has a role to play. So we don't just restrict to political office holders, we reach out to everybody. I don't just stay in the field, I go take samples by myself. I do all that just because we want to eliminate this disease out of this great state. We do coverage evaluation surveys and a lot of things. So thank you very much, Your Excellency and distinguished guests. Thank you.